Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga COVID-19 update. We are live at PIA Western Mindanao Facebook page, One TV Philippines and other partner agencies' Facebook pages, and via cable televisions at MCTV and eMedia. Kukumustahin natin muli ang sitwasyon ng COVID-19 cases and ang ating vaccination program sa buong Zamboanga Peninsula. Kasama natin muli ang Department of Health Region 9. We have the Assistant Regional Director of the DOH IX, Dr. Lenny Joy Johnson Rivera. Welcome, Doc Lenny, sa ating program.
Hi, good morning, Ma'am Myra. Good morning po sa lahat ng nanonood at nakikinig po sa atin dito sa Kapihan. We're so happy to be invited regularly po dito by the PIA as well as other media partners.
Thank you, Doc. Doc, tungo tayo sa ating COVID-19 cases po na update sa buong region and of course yung ating program din sa ating vaccination program.
Okay, thank you very much, Ma'am Myra. Again, magandang umaga po sa lahat. We will be giving you the updates po ng ating COVID-19 cases during this pandemic. So nakikita nyo po ngayon sa screen is our regional case bulletin as of April 16, 2022. Yung active cases na po natin ngayon is only 47. Yung recoveries po natin since the time of pandemic is 57,601 and number of deaths recorded po is 2,486. Total number of cases natin sa entire region natin is 60,134. Kung i-breakdown naman natin siya by provinces, ito yung regional case bulletin natin. So yung active cases by province, nakikita nyo sa screen nyo, ang pinakamarami is still Zamboanga City. The number of their recoveries, syempre mas malaki yung population ng Zamboanga City, we have recoveries also of 27,180 and the number of deaths na meron tayo per province and cities as you can see in the screen and the breakdown of the total cases natin na 60,134. The next slide will show to you naman yung ating specimen process statistics as of April 16, 2022. Ilang bang specimen na process natin? Nakikita natin sa screen for Zamboanga City, we have processed 107 specimen and for Zamboanga del Sur, meron tayong 4 and the rest of the provinces, none including the BARM areas. So we have a total of 111. So sa 111 natin, ito yung breakdown, ito yung resulta ng ating mga specimen na na-process. Sa 107 ng Zamboanga City, ang negative po doon is 104 and yung positive is only 3. Sa total naman na 4 na pinrocess po ng Zamboanga del Sur, 4 po doon ay negative. Wala pong nag-positive. So that's the total of the 111 case specimen na ating na-process for April 16, 2022. The next slide will also show to you yung TTMF bed capacity and utilization, yung nagagamit natin na TTMF. So sa region natin, we have prepared around 349 numbers of TTMF facilities natin. Then out of that 349, meron po tayong 5,711 na beds for our COVID-19 patient. And na-occupy po ngayon is only 1% or 57 beds out of the 5,711. Sa 349 natin na TTMF facilities, we have DOH certified na 48 and PhilHealth accredited na 24. Then titingnan din natin yung healthcare utilization capacity natin. Ito naman yung sa mga hospitals natin. Binabantayan natin kung yung mga wards, isolation, as well as the ICU beds ay na-occupy ba, na kung lumalabas na ba siya dun sa dumadating na ba siya dun sa ating tinatawag na critical level, at binabantayan din natin yung mechanical ventilator use. So nakikita natin na yung ating total COVID ward and isolation beds na 753, ang na-utilize lang natin is 10%. And out of all the ICU beds na meron po tayo sa buong region, ang na-utilize po natin is only 15%. And the mechanical ventilators na nagamit natin for our patient is only 5%. So the next slide will show to you yung vaccination coverage. This actually explains bakit po konti lang po yung ating mga cases ngayon, probably because we all actually follow the minimum public health standard and we encourage everyone to continue implementing the minimum public health standard plus the vaccination. Kung titingnan natin, as of April 13, 2022, ito na po yung number of people na nabakunahan natin. Ito yung breakdown. Yung fully vaccinated, it means have received already the 2 doses, and the partially vaccinated, yun pong mga tao na naka-receive ng first dose but waiting for their second dose. And then we also have the booster doses, which is an added protection for those people who have already fully vaccinated. Ito naman po yung total natin. We usually have an information on the breakdown of the different eligible population. Yung ating A1, yung ating mga frontliners. Then we have the expanded A1, yung mga pregnant women natin. Then A2, the senior citizen. Then the A3, the expanded A3, A4, A5, and the other population. So titingnan natin, kabuuan, milyon-milyon na po yung ating nabakunahan as of April 13, 2021. The next slide will show to you kung ano naman yung status ng ating mga bagets at mga kids. Yung namang mga kids natin na age 12 to 17 years old, na tinatawag natin mga bagets natin, mga teenagers. Ito yung mga partially vaccinated, around 15,339, and fully vaccinated who have received the 2 doses already is 8,584. Yan po ay with comorbidities. With comorbidities na ages 5 to 11 years old naman ay 2,219 na yung partially vaccinated. Yung fully vaccinated is around 748. Then without comorbidities, ito yung walang mga other sakit na mga bata. For age 12 to 17 years old, nandun na po sa 350,000 ang nabakunahan po partially, and fully vaccinated is 326,718. And we're hoping that ito pong mga partially vaccinated na age 12 to 17 ay magpabakuna po dun sa scheduled date na nila for the second dose. Then without comorbidities naman ng ating mga kids na 5 to 11 years old, partially vaccinated is already 99,484 and fully vaccinated is 54,175. We're really hoping na itong mga partially vaccinated, pag nakompleto na po nila yung kanilang second dose, mas lalo na pong dadami yung ating mga fully vaccinated individual that are protected against the COVID-19 virus. The next slide will give to you the total. Ilan na ba out of yung mga na-mention ko po sa inyo na mga population, na mga eligible groups, ilan na ba talaga yung fully vaccinated at partially vaccinated po dito sa region? Sa fully vaccinated, naka 2 million na po tayo ng mga tao na nabakunahan na fully vaccinated. Then for partially vaccinated, yung mga taong 1 dose pa lang ang bakunang nakuha, naghihintay pa for their second dose is around also 2 million. If these people will be fully vaccinated, itong ating partially vaccinated, it will add up with our fully vaccinated. So we will have around 4 million individuals that are fully vaccinated. Then we're also encouraging people that are fully vaccinated who are eligible to have their booster shots. Kasi sa ngayon, we only have 261,838 people who have their booster shots. So, ina-encourage po namin na sana po ay magpa-booster po yung mga tao because this is really an added protection for all of us. Para po to make sure that we are safe as we actually living our normal life now and going out with our friends, relatives, and co-workers. So, sa ngayon po, yan po yung ating updates for the COVID-19.
Thank you po, Doc Lenny. Nakita po natin ngayon, based from your report po, yung record ng ating COVID-19 active cases, which is bumababa na nga dito din sa Zamboanga Peninsula at yung ating vaccination coverage din sa buong Zamboanga Peninsula. Doc Lenny, sa ngayon po, sa kasalukuyan, ang Zamboanga City lamang ang nasa alert level 1 status. And until now, yung other provinces and cities natin in Zamboanga Peninsula is still in alert level 2. And you mentioned po before, no, na this is because nga mababa yung ating low vaccination coverage. Isa ito sa mga dahilan kung bakit hindi pa rin bumababa rin yung alert level status. So ano po ba yung status ngayon sa ating mga provinces? Malapit na po ba sila sa kanilang target coverage para po mag-improve na rin or bumaba na rin yung kanilang alert level status?
Okay, thank you very much, Ma'am Myra. Tama po kayo. We really wanted na mababa po yung kanilang alert level. And sa ngayon, ang kanilang status po for Zamboanga, Sibugay Province, 74% of their senior citizen are fully vaccinated. Pero yung kanilang fully vaccinated rate versus the target population is only 61%. Hence, they cannot be de-escalated. For Zamboanga del Norte naman po, meron na po silang 61% of the 82 coverage. 82 po are the senior citizens po natin and 56% fully vaccinated coverage versus the target population. Well, yung ating Zamboanga del Sur, nasa 58% pa lang yung kanilang A2 coverage or the senior citizen and 55% fully vax coverage versus the target population. Sa Pagadian City naman, we also need to ramp up din po yung kanilang A2 coverage since they only have 57%, despite covering the 74% na nung kanilang population. We really wish that ma-reach natin yung 80% kasi yun po yung gusto talaga natin na marami pong tao na bakunahan. At to make sure that the partially vaccinated will really have their second dose. Kasi pag nag-second dose na po itong 2 million na tao na first dose, magiging 4 million na po yung ating number of people being vaccinated. So dadami na po yung ating people that are protected. Thus, we're encouraging everyone to have yourself vaccinated po talaga, to be fully vaccinated and have the booster shot sa mga fully vaccinated on these different provinces because we really like na mag-level 1 din sila tulad po dito sa Zamboanga City.
Thank you very much, Doc. Doc, of course, nakikita natin yung efforts ng ating health workers. Ako personally, nakikita ko po sila na talagang nag-e-encourage po no, sa mga barangays natin to get their booster vaccination. Aside po ba sa ating mga house-to-house efforts na ginagawa, ano pa po yung other efforts na ginagawa po ng Department of Health and then yung iba po, yung ating mga city health office po para po ma-increase yung ating booster vaccination coverage?
Okay, tama ka Mayra, no? Marami ng effort talaga yung ating mga healthcare workers. Doon pa lang sa pag house to house nila habang umuulan is hindi po talaga mapantayan yung mga effort na ginagawa ng ating mga healthcare workers. Ginagawa nila yun para po sa mga ating kababayan to be protected kasi nakita naman natin kung ano ang kinahihinatnan pag nagkaka-surge talaga tayo. And aside from the house to house, we are really strengthening yung collaboration with the different partners as well as yung mga private sectors natin na sana to encourage their employees, their workers to be fully vaccinated as well as their families and to give them opportunity to be vaccinated and to be protected while going to work. And aside from that, we are awaiting also policies from IATF on the revision of the definition of fully vaccinated that it would actually include already the booster doses para po to ensure that tuloy-tuloy po yung protection ng mga kababayan po natin. And we can actually live a more normal life po talaga.
Thank you, Doc. Doc, syempre nakikita rin natin na nagsisimula na po yung ating limited face-to-face classes sa ating mga elementary schools and even sa ating mga secondary and yung sa ating mga college students. Are you recommending po ba children especially po who are not fully vaccinated to attend the limited face-to-face classes?
Okay, thank you, Mamar. We encourage our parents to have their fully vaccinated before the full implementation of the face-to-face learning. This will actually added protection po kasi dun sa ating mga bata. Alam naman natin yung interaction talaga sa school. So, as parents, we would really like to encourage you to have themselves vaccinated. And those partially vaccinated na mga kids natin before po mag face-to-face learning, sana po ay mapagunahan na natin dun sa schedule date nila ng second dose para po pag nag-start na po yung ating face-to-face, we are ensured as parents na protected po yung ating kids, having interactions with other kids and other people in the school.
Opo, and then knowing nga na yung children rin is vulnerable then to get the COVID-19 po, no? So, yun po, no, yung advice, of course, ni Doc Lenny. Lastly na lamang po, Doc, papalapit na yung ating national elections 2022. Ano po yung preparations natin? And marami pong nagsasabi na mag-e-expect ba tayo to have a surge of cases after the election?
Well, with all the activities that we have, no, if hindi tayo nag-maintain ng minimum public health standard, we will really be expecting surge if ever. Tulad po ng ating mga neighboring countries ngayon, that's what happening in China and other countries. Nakikita natin na nag-lockdown sila. Mas the more stricter yung lockdown ngayon nila based on the news nga na naririnig po natin. Nasa news, nasa newspaper, nasa any media platform talaga yung mga lockdowns and surge ng ibang countries. We really wanted na hindi po yun mangyari dito. So as to having a surge cases after the election, it depends actually on the people. Kailangan po natin mag-maintain ng minimum public health standard, yung ating social distancing, yung mga pag-join natin ng mga gathering, make sure po na we still wear the mask, we have social distancing, then we have reduced occupancy in indoor spaces, and of course, washing your hands is also very important, and having yourself vaccinated and booster shots is very important para po ma-protect po kayo lalo against this virus and also against other viruses. Yung pag-wear po natin ng ating mask, yung ating paghugas ng kamay, are ways also to protect ourselves from other diseases. Hindi lang naman po yung COVID-19.
Thank you very much. Doc, maraming salamat po, no? Ngayon po, continuous pa rin yung ating daily vaccination program. Do we have closing message po? And then encourage po ang ating lahat po ng manonood, lalo po sa mga hindi pa nakakapagpa-booster.
Yes po. Thank you, Ma'am Mar, for this opportunity. I would really like to ask everyone to have yourself vaccinated as much as possible. Encourage for our families, friends, relatives to have themselves vaccinated and be protected against this COVID-19 virus. And aside from COVID-19 po, kanina po namin sinasabi po ulit-ulit yung ating mga minimum public health standards. Siguro nagsasawa na tayong makinig sa lagi namin sinasabi ng MPHS, mga bida solusyon namin. Lagi po namin yan nire-remind. And of course, the vaccination. And all other issues na nga binabato po because of this vaccination. But we still encourage everyone to be vaccinated because it's scientifically proven that it can actually help our community when it comes to the minimizing the possibility of any surge or outbreak of COVID-19. And aside from COVID-19 pandemic, we would really like to take this opportunity, the DOH should like to take this opportunity on informing everyone the need to guard our families against dengue, which is now a year-round disease. It's actually an acute viral infection that affects mostly our children and our infants. Kasi yung cases natin ngayon, ang pinakamarami is 1 to 20 years old. So, based on the latest update, may mga more than 1,000 na po ang dengue cases natin over a period lang ng January to April, and we have already recorded around 17 deaths. That's the reason we want to encourage everyone to please implement the 4S since it's rainy season. Yung search and destroy po natin, huwag po natin kalimutan, search and destroy mosquito breeding places, secure self-protection measures like wearing yung long pants, jogging pants natin, yung long sleeve, daily use of mosquito repellents to protect our kids na naglalaro po sa labas or nasa labas ng bahay natin. And then, seek early consultation as much as possible. Kung meron pong nararamdaman, magpakonsulta na po agad. Then, support yung fogging and spraying only in hotspot areas where increase in cases in registered for 2 consecutive weeks to prevent an impending outbreak. And another thing na gusto po namin i-announce po sa mga tao, meron po tayong gaganapin na chikiting vaccination days. Ito naman po yung ating routine and catch-up immunization. Magsasimula po tong April to June 2022, every last week of the month. That's Thursday and Friday po. So, ang gagawin lang po mostly is vaccination on this catch-up immunization natin. So there would be a temporary suspension of COVID-19 vaccination and other program activities, health program activities, para gawin lang po itong ating COVID-19 National Vaccination Day or tinatawag po namin ngayong Chikiting Vaccination Days para po ma-prevent po natin yung impending outbreak naman ng other vaccine preventable diseases such as measles. Kasi alam natin na outbreak po tayo nung 2019. So hindi na po dapat maulit siya this year. So we're hoping na lahat po ng mga parents to bring their children infant 0 to 23 months, na hindi po nakumpleto yung kanilang vaccination dahil sa pandemic, sa lockdown, na lumahok po dito sa ating chikiting vaccination day to ensure full protection of our children from vaccine preventable diseases. Yun lang po, Ma'am Mar. Thank you.
Maraming salamat po once again, Doc Lenny. Tama nga po, no, hindi lang yung COVID-19 yung ating tinututukan because we also have other health concerns po na dapat rin nating tutukan dito sa Zamboanga Peninsula. Once again po, maraming salamat sa Department of Health and the Assistant Regional Director po ng DOH IX, Dr. Lenny Joy Johnson Rivera. Thank you, Doc, and see you po sa ating mga susunod po na COVID-19 update. Maraming salamat. Opo, maraming salamat rin pong muli sa lahat din ng ating manonood ngayong araw. Magkita-kita tayo sa mga susunod pa po nating Kapihan na Zamboanga COVID-19 update. Ito si Myra Espinosa. Mag-ingat tayong lahat. Tiyanek cuidado. Muchísimas gracias.